Hi, my name is Aaron Armstrong. I'm a cardiology fellow at University of California, Davis Medical Center. And my presentation is on psoriasis and the risk of developing atrial fibrillation. Psoriasis is a chronic inflammatory disease of the skin that is typically treated by dermatologists, but increasing evidence has suggested that patients with psoriasis are actually at increased risk of coronary disease and incident myocardial infarction, likely due to similar underlying immune-mediated mechanisms. We were interested in whether psoriasis may increase the incidence of atrial fibrillation, given that other immune-mediated mechanisms may also be related to atrial fibrillation. To answer this question, we developed a unique cohort where we linked patients who underwent cardiac catheterization with dermatology records so that we were able to identify patients with coronary disease and who underwent cardiac catheterization who also had psoriasis. And we then took matched controls of 169 patients with psoriasis matched to patients who did not have psoriasis and calculated their predicted risk for developing psoriasis based on the Framingham risk score, which integrates baseline demographic factors as well as electrocardiographic variables for prediction of atrial fibrillation incidence. And what we found was that although patients with psoriasis tended to have a slightly higher body mass index and LDL compared to matched controls, the overall predicted risk for developing atrial fibrillation was similar at approximately 12% over 10 years. We then followed the actual incidence of atrial fibrillation by review of medical records and found that among all patients with psoriasis, the hazard ratio for developing atrial fibrillation was similar for the entire cohort with a hazard ratio of approximately 1.1, which was non-significant. However, when we looked at the subset of patients with moderate to severe psoriasis, who typically require systemic therapies, we found that there was a trend towards increased incidence of atrial fibrillation with a hazard ratio of about 1.3, suggesting that patients with moderate to severe psoriasis may have approximately 30% increased risk of developing atrial fibrillation over time. This is a small study, and I think it will need to be confirmed in a larger cohort, but I think it also raises the question of whether psoriasis may predispose to some other novel risk factors apart from what can be predicted with standard risk mechanisms.